Hi guys, welcome back to the channel, and in this video I want to talk about some really important nutritional research that will be of utmost relevance to anyone living with cancer or trying to prevent cancer or trying to prevent a recurrence of cancer. Okay, because when we're living with cancer or we're managing cancer, the adoption of a robust anti-cancer diet becomes the foundation of our survivorship protocol. It's absolutely integral. And over the years, there's been lots of really fascinating research trying to tease apart, trying to delineate. Is there a causal association between certain foods and better survival times? And as people eat more of those foods, do you see an increase in longer survival times, an improvement in survival times? And I just wanted to come on to flag up one particularly important piece of research that has really shown that causal link between if we eat more of these types of foods, it is clinically associated with better survival times. Okay. And this was a study that was done exclusively in women with breast cancer. And it followed these women for 6 years, which is a really significant period of time in the context of clinical research. And the most important finding, there were lots of findings from that study, but the most important one, and I think it's really key for all of us, whether we're trying to manage cancer or whether we're trying to prevent cancer, was that as the volume of beta carotene went up, so as these women ate more beta carotene, their death rate dropped and their survival time increased significantly. Okay. And to put that into perspective, how significant that finding was over the 6 year period with 103 women, over that 6 year period, only one woman who had in the high carotene group, so in the women with breast cancer who were having high levels of daily beta carotene through the food they were eating, there was only one death over that 6 year period. Okay, but in the women with the lowest levels of beta carotene, there were 12 deaths over that 6 year period. Okay, which, across 103 women is quite a high percentage. So you've got the women eating lots of beta carotene, only one death. Okay, in the women having the lowest level, you have 12 deaths. Okay, and it was the beta carotene intake that was causally linked to that survival ratio. And this is really important findings, okay, because it's over a long period of time. And it makes a lot of sense because when we dive into and start exploring actually what is beta carotene, what we see is that the actual structure, the molecular makeup, the impact of beta carotene, we now know impacts upon a whole variety of mechanisms in the body relevant to the suppression, the destruction, the inhibition of cancer cell biology. Okay, so for those of us, who are trying to stay healthy, those of us who are trying to manage cancer, or if we're living with cancer, what this research suggests is that we need to really proactively target the consumption, the daily consumption of high beta carotene foods. And they're easy to consume. Okay, they're your common staple vegetables, things like carrots, sweet potatoes, spinach, tomatoes. Okay, these are not difficult foods to consume, but we want to be kind of making sure we're in that high beta carotene group. So we're having them, a lot of them, and we're having them on a daily basis to make sure that the levels of beta carotene in the blood are operating at that high level, because it's at that high level we seem to have that protective impact that's linked to lower death rates, increased survival times. Okay, so really important data. If you're living with cancer, if you're managing cancer and you've got any specific questions about that, please let me know in the comments below. And as always, if you want to stay up to date with these videos around all things health promotion, Ayurveda, nutritional medicine, please do subscribe so you will never miss a video. And I'll see you soon.